Good morning, everyone. Welcome to Carrying School. My name is Karishma. I'm the program head of the SIG Learning Series. Today, we're going to talk about interdimensional health and healing beyond the physical with Dr. Geoffrey Montague-Smith. Dr. Geoffrey knew from an early age that he wanted to be a healing arts practitioner. Seeing how osteopathy helped his father overcome healing back pain, he trained from the British School of Osteopathy in 1989 and he won a prize for osteopathic techniques, but that wasn't enough because he felt that there was more to healing. And then you were initiated by the Spiritual Therapeutic School in the UK by some incredible gurus that I'm sure we're going to talk about. Dr. Geoffrey is a pioneer in holosonic sound therapy, something that he has developed, and he is a master practitioner of electroacupuncture. He founded the Ackman Clinic in London in 1995, and he's been combining traditional osteopathy with healing, holistic healing techniques ever since. Welcome, thank you for being here.
It's a pleasure, thank you. Thank you for asking me.
So, interdimensional health. You know, energy is a word that we use so flippantly today. You know, I really like her energy. You know, I don't think I can handle this energy. What does it mean when we talk about our health being interdimensional in sort of this energetic field that you actually have up there?
Yeah. Well, you know, you can see in the middle there, you've got the sort of representation of the physical body.
I think you're going to need your mic.
Which typically when we go to see a doctor, they're thinking very much about what's happening at a material level with the physical substance of the body. And that's certainly true as an osteopath. When I did my initial training, you know, the whole mandate really was, let's examine the physical body, let's see where the blocks are in the physical body, and let's teach you how to unblock the blockages, because I think it's true for all healing arts. If we can identify obstacles to cure, then the body can heal itself. So there's an innate self-healing mechanism, and if the body isn't recovering from an illness or a problem, it's because somewhere there's a block. You know, if you cut yourself and, you know, you get bleeding and then there's a scab, and then a little while later the scab drops off, and then when you look back you can't really see any evidence of the damage if it's not too deep. So there's this, we call it syntropy, where there's an innate tendency to want to be perfect. And mostly that's ignored in medicine. If you have a problem, they're going to find, well, okay, here's the symptom, here's the problem, here's a drug to suppress, you know, the symptom. And quite often, orthodox medicine suppresses the actual healing mechanism, because sometimes a symptom can be a call for healing. So it's quite interesting how we might use a drug to stop the body doing what it needs to do to actually fully recover. So as an osteopath, you know, we were taught to work on the physical body, and I was, you know, successful at that. We got into pediatrics, so the cranial work takes you into working with expectant mothers and children. And then you wake up at a certain point. I think I was 5 years in when I woke up and I thought, you know, there are some patients we just can't fix. And you get sold the myth that osteopathy is a system of medicine in its own right. You know, from the background of Dr. Still, that was how they kind of, because in those days, in the 1880s, when he conceived of osteopathy, they were still leeching people. I know it's trendy again now, but you know, they were using very basic medicine. People were dying of pneumonia, and he was taking patients with a pneumonia situation and using osteopathy to free the lungs and free the lymph and actually get people better. So we came from that background, but then you reach a point that the world has moved on, and so that's why I was very fortunate to meet Peter Goldman, who is a naturopath and osteopath, and he taught me, he founded the concept of sound came from the College of Spiritual Psychotherapeutics, and that has a long tradition of teaching that there is a light body with energy centers linked to the main nerve gland center. I've got a few pictures that we can go through later. And health comes out of the biofield. So if the light body isn't able to speak to every cell of the body, then you can't have good cellular health. So physically, we are connected to the energy, and everyone gets
So we're like musical energy frequencies.
really musical. No, these are light frequencies, and so it's across the frequency spectrum. But I can go through into the detail, and maybe we can use some of the pictures as a means of illustrating that. Because it's not about tone or musicality, or it's the tuning forks that we use are a means of determining if there's a lack of flow in the light body, or the auric field, or biofield as it's called by the scientists.
So I'm going to break this down a little bit, because it's all, I think now we're very receptive to understanding energy healing. What's incredible is you were a completely Western trained doctor who's gone down this sort of spiritual path, and you're talking about chakras and energy fields, which is something, coming from my background. I'm an Indian, my background is Indian, it's in my books, there's so much of this, and the fact that you are actually using this on a daily basis is pretty incredible. I went to see Dr. Geoffrey, and when the time comes, he will call upon one of you just to show you how this kind of works. What made you do this? What was the tipping point that said, okay, I need to combine these things? How did you realize that it works?
Yeah, that evolved with there's no such thing as coincidence, it's always serendipity. So I was practicing as an osteopath in Tunbridge Wells, which is just south of London. And a lady, I'll never forget, her name's Felicia Hussain. So she came for treatment, and I treated her, and then she went back to Peter Goldman and said, I found a guy that's got what you need. And he came for treatment, he's an osteopath. So I said, there's no fee because it's the brotherhood thing, and he said, oh, no, I must pay. And I said, no, you mustn't, because we just honour the code kind of thing. I didn't have a clue who this guy was. And afterwards, I'd finished working on him, got him, tuned and better and stuff. And then he said, you must come and listen to my stuff, were his exact words. And I thought, what do you mean your stuff? And he invited me to one of his workshops. So I'm a very mechanistic osteopath.
Yeah, you want to prize in technique.
Yeah, and I was a regular guy. I didn't really know, I'd had a big tragedy in my second year of uni where my friend Mark fell from a balcony in Ibiza, and I was with him as he died, and I saw his energy field leave his body. So that got me thinking.
You actually saw?
Yeah, it was like a rainbow. I just, I knew his soul had gone, if you can say that, but his physical body, we still had a pulse and he was still breathing, but his energy had gone. So I was 21, and that got me thinking about what animates the body. So we're flesh and bones, but what animates us? If you drive a Mercedes right now, you're the driver of the car, which is the vehicle. You could step out of your Mercedes and get into what would be a move up from a Mercedes, a Bentley, and you've done an upgrade. So you're still the driver. It's still Jeff driving the car. So if we look at the physical body as a vehicle, you could say, well, who's the driver? What is the driver? At what level is there a driver that might utilise multiple different vehicles? So those sort of questions came up for me. I was looking at out-of-body experience, the science around that. I was looking at, so I was looking for answers while doing my regular practice. And Peter came along. I went to his workshop, and in the middle of the countryside around Tunbridge Wells where I live, there was this centre that I didn't even know existed. I'd never heard of it. There was a pyramid-shaped classroom, huge pyramid roof on it, and I thought, and then there was a little gallery where there was like a meditation space.
It's all very Illuminati.
All hand built by Ronald Beasley, the founder, and I thought, this is cult. This is like, I need to get away from here as quickly as possible. I need to run. And Anyway, Peter explained that, he showed me around, and he had the colour room was there, and he did his best to explain it to me, but I didn't fully understand at that point. I just felt nervous, and I was going to get sucked into something. Long story short, the workshops that he ran just completely transformed my life. The idea of spiritual psychotherapeutics, the idea of understanding the reference point into the light body through the different chakras, the idea that we can see that we've got multiple frequencies around the body.
If you need to, you can stand up and explain.
No, it's fine.
Okay.
The field informs the physical. So there are multiple, like in this room right now, we've got radio, TV, we've got, Wi-Fi, all the different frequencies that are moving through this space have information in them. And whether we attune to that information determines whether we can get to the information. So the field, you could say the robe of many colours is structured in a way where we've got a field that links closely to the body, which is red. It's not really coming up on the projector here. And then there's an orange field, and then a yellow, a green, and then we've got the higher levels beyond that, blue, indigo and violet. So the 7 colours of the rainbow all have a different reference point. So if the red field links very closely to the physical, and the orange field links very closely to our emotions, and the yellow field links closely to our intellectual capacities, and then the green field is like an interface point that connects the material level, the 3D, with the what we call the upper triune, the higher levels of spirit and soul. So if the body is going to take form, it is essentially precipitated out of the fluid body. So the fluid body is, you could say, a carrier medium for the information. Consciousness comes through to the fluid body, and then the physical body is precipitated out of the blood. And we're in a constant state of transition. So if you end up in a situation where there's a problem in the body, it can be because there's a flaw in the field. And if you can't access the flaw in the field, then the cells of the body that are looking for a reference point for perfect, they can't find it. So that's how we have to work.
Prevent diseases then if you find a flaw in the field.
If you work, the slides that they're complicated.
Yeah, they're a bit technical.
If you work further out in the field, if there's a problem, let's say there's some well-meaning parents told you a certain thing. So at the intellectual level, you've got a belief system that X, Y, or Z is a truth, and it turns out that maybe they weren't really giving you the whole story.
Right.
And you've got this program running. So at an intellectual level, there's a sort of a conflict. Or you could say, let's say in the orange field, there's an emotion that you had an experience.
You can tell that they haven't told you something. You can tell that something's blocked.
If we work with the sound, you can actually find where those blocks are. So, for example, let me jump ahead here. We're getting a little bit out of sequence. Let's say, for example, that someone comes in with a liver problem and they're having a hormonal issue because the liver conjugates the hormones. So if the liver isn't functioning correctly, not only won't you get essentially, good detox, good digestive system, you'll have a hormone insufficiency. Now it could be that liver at the physical level isn't functioning properly because of a disturbance somewhere in the energy field as it relates to the liver. So you could have a transgenerational issue in the liver. Your liver could not be working properly.
So you're talking about generational trauma now?
Because you had an angry alcoholic grandfather. So with the angry alcoholic grandfather, he then conceives your mum or dad, and then that imprint comes through to you. So now you're carrying the imprint of a liver that is insufficient because of a transgenerational issue in one of your ancestors, and that's stuck in the energy field. So you could end up with a hormone problem. Transitioning into menopause could be a big problem because of that script that's running from the ancestry side. It could be your own emotion. It could be that you had a husband who was unfaithful and you got so angry that anger stores in the liver, grief and sadness are in the lungs, indecision is in the gallbladder, fear is in the kidneys. So everything has its own emotional context as well. So sometimes we could have a problem in the body because of an emotion that we felt in a high stress or a difficult situation. So if you don't understand the context for that, then as a doctor, you might have someone come in with a kidney problem and you won't understand. They might say, oh, I'm anxious and I've got a kidney problem, but you won't necessarily get to the truth of why.
Yeah.
That's the key thing to understand. If the light body isn't flowing, if we don't have a clear connection where the cells of the liver can reference to the frequency into the field that governs the liver can never be healthy.
Wow. Okay. Right.
Have I just confused you?
I'm just wondering, how do normal osteopaths respond to you?
Is everybody else tracking me? Is it like, yeah, okay.
We're going to go into questions really soon. I want to know, this can be used alongside conventional medicine because you do that. You do conventional osteopathic healing as well.
Yeah.
Are there any chronic diseases? Can this help? This method, can this help prevent or?
Most chronic disease, by its very nature, is because there's a block in the field.
Right.
If something's chronic and locked in, it's because the body hasn't been able to fix itself. So in an acute situation, you might say, I've got a sore throat because, I've just picked up an illness and my tonsils are all inflamed, and inflammation is part of a healing response. The body does a brilliant job, there's a nice temperature, and then everything goes back to normal. So a week later you're fine. That's no problem because that's the body self-healing.
Yeah.
The problem is if you have that situation and it then doesn't heal itself.
Keeps recurring.
Well, recurring or it never goes away.
Right.
And then you need to look at, well, why? So you might have a problem in the throat because you're not speaking a truth to somebody. You might have something that you need to tell somebody and you're just refusing to be brave enough to tell them, or you don't want to hurt them or whatever. So the throat center's all closed up. So if the throat chakra is not sufficiently open, and you could say when we look at the meridian testing, which is a whole other thing because
So meridian testing is kind of like acupuncture, you do it electrically.
What we say that the energy field transmits through to the physical body via the different chakras, and the chakras are connected in ultimately to the meridian pathways. The meridian pathways and the flow through the meridians then determines what happens at the more physical. So it's like a stepped down process. If we go back, the light of the soul is very, very powerful, and it has to be stepped down to the point where it comes into form. And all of the ancient myths talk about, the creation myths talk about that. There's darkness, and there's light, then there's sound, and then there's form.
To the mic, this is the problem. People really can't hear. We've got a sound issue.
So if we're working far out in the field, we're working with a huge amount of potential. And what we need to do is we need to work with that potential. At the highest point of leverage is further out in the field, and I think this is where a lot of medicine goes wrong, and even holistic medicine, when they work with nutritional supplements and herbs, which are very much physical in their nature in terms of their action. When we want to get a little bit higher in terms of leverage, then we need to go to frequency medicines, homeopathics, particularly detoxifiers and that kind of thing. So what we say is, if we can clear the field first of all, if you can align the field, so we have the idea of a soul note that comes through the midline, and there's a certain, you could say, given frequency for each life. I'm very lucky. I know why I'm on the planet. I'm very much aligned with my purpose. I feel that there's good attunement. In osteopathic medicine, we talk about, having the pelvis straight and the spine straight.
Yeah.
At a physical level, we've got to make sure we've got that midline.
Yeah.
And that's true energetically as well, because if the body's crooked, if the energy fields are twisted up or disturbed, if the chakras are blocked, the meridians are not flowing, then the communication, you could say the light of the soul, will not come through to you as a human being. And Atman, which is why we call ourselves the Atman Clinic, is the state of perfection at the level of mind, body, spirit. That's what that Sanskrit word means. So if the physical body is aligned, and that's where the osteopath and the chiropractor will come in, and the meridians are all flowing, and the energy field is coherent, then you should feel very aligned with your core purpose.
Right.
So a lot of people are wandering generalities. They're drifting around. They don't really know why they're here, and it's a real shame when you see that, because quite often with just a little bit of orientation, you can connect them to this, and then suddenly they meet the right people. They start to lose the people that they shouldn't be with. There's almost like a magnetic, you could say, attraction.
Sort of repelling and attracting.
Yes, and it is energetic. You know, you said in the very beginning, you said people talk about energy and we don't know what it means. Well, you know, when someone walks in the room and you take a look at them from a subtle level, you get a sense of whether or not they feel okay at that very instinctive level. You kind of get, oh, I don't like the look, you know, and or that, you know.
Yeah.
You start to find that things work. And with the soul note, I always like the idea of an orchestra where, you know, Geoff has got a certain thing to do in the world. It's like being given an instrument and having a particular part to play. And if I know what my part is and you know what your part is, and everybody else has their particular unique connection to why they're here, why they chose to incarnate, then like in an orchestra, if everybody's doing their little bit, then we make beautiful music. And the world should be perfect. It shouldn't be in conflict, and there shouldn't be dissonance anywhere. And I think the sad thing is that a lot of people don't have that connection, and it's like a TV aerial being misaligned. If you've got that TV aerial misaligned, then you won't get a clear picture.
Yeah.
As soon as it comes into alignment, you're going to get a very clear picture.
Right.
And that's, for me, about the life path. And that is the biggest gift you can give someone. Is how can you get them connected to this stuff. Oh God, it's all so important, but we're not going to have time to go into some of this stuff. Right, any more?
Yeah, I think because, you know, this is very internal, it's very innate to us at some point, but then we need to rely on evidence. And is there evidence that shows that this is all there, scientific evidence?
Well, I think what's interesting
Does it support the effectiveness of frequency medicine?
Well, right now, everyone goes on about evidence-based medicine. So the osteopathic school where I trained has just joined with the chiropractic school because they have a lack of students. Now, we should have more students for osteopathy, not less. And the problem is they've gone down an evidence-based route.
Yeah.
And so students are saying, okay, I can go and learn evidence-based osteopathy, but basically you're just learning physio. They've lost the magic and the soul of osteopathy. I prefer to work with the idea of medical-based evidence, because what I think we should be doing is we should be doing medicine and creating evidence for our medicine.
Right.
So as a synopsis, recently in the clinic, and look, we're not here to treat cancer, we're here to treat a human being who might have a cancer diagnosis. Let's just say that.
So you can do this, you can treat.
I'm going to give you an example of a case. So Paul came to me, he's the relative of a good friend of mine. He's just married, his sister just got married to this guy called Paul. And he came in, he said, I'm going to be dead by April, and they can't offer me any treatment. He was, he's in his 70s. And anyway, he had a lung tumour in the upper lobe of the left lung. And now we know the lung's linked to grief and sadness, and they're not offering him any treatment. They've told him he won't last longer than April. This was February. So I
February this year?
This year.
Yeah, okay.
So I talked to him and I said, look, Paul, is there a story around sadness and grief? And particularly the left side links to the feminine and the right side links to the masculine. And he told me this detailed story about his sister and how it had impacted him. I won't go into all the details. But when I checked him with the tuning forks, which I'll show you in a minute, there was huge dissonance over the left upper lobe where he had the cancer. And he was also physically, his head, the fascia, was pulling him into a pattern of side bending left and tension into the upper lobe. So we knew there was physically a problem in there as well, so he needed osteopathy for that. When I checked the meridians with the EAV machine, there was a really big blockage in the left sinus, which is mucous membrane, and lung. So we could see the blockage in the meridians, and it was measurable in those two pathways. And then it was possible to check which remedies, homeopathics and herbs, in his case it was a combination, that unblocked that block. So we'd fixed the blockage in the energy field with the sound. We'd given him structural work to open him up so that he wasn't all congested physically. And we found the remedies that he needed to take for the next 8 weeks to undo the blockage in the meridian. Because if the energy field can't signal through to the lung, if you've got a lung issue here, because there's a blockage in the field and the meridians are completely blocked, you've got to find a solution. That is interdimensional health. Because you're working physically, you're working in the meridians with the appropriate remedies, natural remedies, and you're working in the field, and you're working with the psychotherapeutic aspect, because he hadn't connected his lung cancer to the issue with his sister. So that's a kind of a proper way of treating the patient. Anyway, fast forward to April, he's not dead. May comes back to see me, because we need to give it normally 10 to 12 weeks in those situations for the work to work. Find it, fix it, leave it alone. It's the old osteopathic maxim, and let the work do the work. So he came back, I remeasured him. We know the sinus is now within normal limits. The lung was very much better. He had a few other problems. We went to liver, a kidney and stuff. Gave him some more remedies, and then he gets a scan, and they said the tumours have stopped growing.
Wow.
So now he's not got a growth situation, he's got a steady situation. And I saw him again in August, and he was measuring much, much better, looked amazing. I said, weird, you should be dead and you're not. He said, no, I feel great. And anyway, so September I went for another scan, and now the tumours are shrinking. So he's getting better, because his body is now connected back to the light of the soul. So the cells of the lung know what it is to be more perfect. So there's no place or frequency for the cancer to thrive and grow. It's almost the body now is able to. So that, we need to understand that you've got multiple levels of being. We are interdimensional beings. You need the medicine to reflect the fact that there are these multiple dimensions, and you have to teach practitioners to have an entry point into each particular, you could say, level of frequency.
Right.
And that's the key thing. So I know he's going to get better. The irony of it is that he went to the oncologist and said, "Would you like me to tell you what I've been doing?" And the oncologist said, "No, that won't be necessary." So that's fine. In the old days, the doctors used to say, "Don't do any of that." Now they're saying, "No, I don't need to know what you're doing, but keep doing what you're doing, because at least there's now much more openness to them than having a different path." But I can't help thinking that if I was an oncologist and I had an example of this happening in front of my eyes, I'd say, "Look, I'm going to cancel 2 hours next week. Can you come in and bring all your stuff and show me what you've been doing, because I'm interested." I think that will be the next step, and then there'll be proper integration, medicine-based evidence, where we do the medicine and create evidence. I think is the way forward, and I think the way we do that is to collaborate. So I've always felt I'm like a bridge between the crazy, loony, wacky, fringe kind of, and that's how it started for me, because I was, structured osteopath turns into aura chakra guy,
Yeah.
and there's a bridge between the two.
I mean, for any normal person can be like, that's a bit wacko.
Yeah.
But it works. So how about we start by demonstrating how it works? Because we've talked about this. I think everyone's a little confused, but very receptive. Should we kind of just go step by step? That there, do you want to show that?
No, I think that takes a bit of time to set up.
No worries, just in terms of what you do with it. That is just a very simple electronic meter, isn't it? It is an electrical measurement meter. It's not new technology or anything, is it?
No, it's Dr. Vol. This is called EAV testing.
Can everyone hear? No.
You're here?
Yeah.
So this is essentially an ohm meter. It measures the skin resistance. So the patient holds onto an electrode. If you grab that. Yeah. We just get. Right. First thing we've got to do is establish whether you're alive or not. So there's microcurrent coming in here. Yeah. It's a dry test, right? If you give me this one. So you can see the current is going through the body. Okay, so you are actually alive, so that's good.
Is that like high levels of stress there?
No, that's high levels of very good conduction.
Excellent, okay.
So sometimes we'll find a very low reading where that measurement, this is a pre-test we're doing, that measurement will be down here, be low. And that will be because the patient is dehydrated, so the current can't flow from cell to cell, or they're demineralized, or there's a large, you could say structural block. You could have fallen off a horse and had a shock, and then there'll be a blockage to the flow of energy through the body. The next thing we've got to do is check for left spin. Now in a minute I'll talk about left spin when I show the tuning forks, because it's absolutely vital. But if you're in left spin,
what does left spin mean?
Left spin is when the energy field is spinning counter to life. Right spin is pro-life, left spin is against.
Meaning something's kind of wrong.
Something's very wrong.
Okay.
If you're in left spin, something's very, very wrong.
Okay.
You're saying no to life at a subtle level. So
we're all saying yes.
If I put that in the circuit, I need to find out whether the patient recognizes it as a toxin, because that's Freon from an air conditioning unit. Now we're making your hand wet, so we've got reliable conduction. I'm now going to take a reading from this finger here, and you just pray you're not in left spin. And you're not in left spin, okay? Because it's stressing you, so that's the normal response to a toxin. Okay. I had a lady the other day who's really in not a good situation, and this was in the green zone. She couldn't even recognize the toxin as a toxin. So that's left spin. Right, now I'll jump ahead because we won't.
So what was that?
This is the autonomic nervous system on the right, which is the parasympathetic. This is your rest, relax, digest, feel safe point. Hold nicely there. Okay. Not bad. Very good. It's in the green zone. If it's between 40 and 60, we know that we're happy. Yeah. Hands up, we've had a few had this done. You guys in the back, you all know what I'm talking about, right? Yeah, okay. Now we'll do the stress response, which is your survival response. This is if a tiger is chasing you, can you run away successfully? So your stress response is a little bit over-egged. So we'd say you're probably a little bit like that, okay?
But I said coffee, would that affect it?
This goes deeper than the coffee. You can sit here with a monster hangover and we'd still see what we need to see. Now, okay, so what we're going to do now is we're going to just got the tonsil channel on the right and lymph, and we'll check the hormone channel as well, just so everyone can get a rough idea of what this is capable of, okay? So if we start with the tonsils, first line of defense, a little bit stressy. This is the lymph control point now. And then jaw drainage. It's on the low side of normal. So that's the lymph of the jaw, and dental issues sometimes will show up there. Sinus.
Yeah, I was expecting that.
Yeah, that's not so good, right? So now let's just... So this is the adrenal point now. Now we've just got the hormone channel. And there's a bit of stress. Oh.
What's that mean?
So now you've got stress in the master point for the hormone system, and it's leaking as well. It can't hold the energy. So we'd say that there probably is a hormonal component to what's going on. We can go to the thyroid. And then we can do pituitary and pineal. A bit low. So you can see there, you're getting a sense of what's going on. And if we then decide that, let's say that's the pathway that needs help, we can then go to the different remedies. You've got 30,000 different frequency signatures, different remedy lines. We use Physica. And at that point, you could start to say, right, if I've got a pituitary pineal block, then I could use a remedy like pineal code to maybe fix that. So you go through all the remedies and find which one.
And these are homeopathic remedies.
These are homeopathic, but we've got herbs, nutritionals and everything.
And
So
do sound frequency too, or not?
yeah, well, that would be
Do you want to do the sound frequency demonstration, or should we get someone else? You guys,
the most important thing.
Somebody else over to I want to do it.
I just want to quickly show you guys though that if we go into a remedy like pineal code, you can see here it's a complex homeopathic, and aurum metallicum at that high potency, berberis, calcara, that basically takes the fluoride out of the pineal gland. The remedy is built, the aurum metallicum is gold, metallic gold, and the ancient Egyptians used gold, white gold, to connect the crown chakra. So the homeopathic remedy is designed to work directly into, that's why it's called pineal code. It opens up the light receptor. The pineal gland is light tissue. So the way Rob has formulated these remedies, they're designed specifically for this kind of high-level work. So you would choose that remedy if you needed that remedy. It would balance you to 50. And that's how we select the remedies. And then you know that that particular pathway is unblocked, okay?
Yeah.
Now that's useless if the energy field is blocked. So that's where the sound comes in. So that's what we'll do now. I'll show you how that works.
should we get someone else to come up, or do you want to, how do we do this?
I'm happy either way. We just need to put a chair right here.
Do you want
I
to,
think she wants to go. I'm making into everything.
can we all give her a hand?
Oh yeah, well done. There we go.
Yeah.
No, I need it needs to be one of these chairs if that's all right. I'll let you face everybody, okay? Let me just go back to this. Now, if there's static in the human aura,
Oh, Dr. Jeff, please. No one will be able to hear you. Can you manage? Okay. I'm going to hold.
now,
Yeah.
you'll hear me if I raise my voice. If there's static in the human energy field, we
No,
have
maybe
to take,
you shouldn't
we have
have
to
it,
take
just-
the static out of the field, otherwise the light body is holding information that is going to block the cells of the body from getting the right message, because the light body should be speaking to every cell of the light of the soul should be in every cell of the body. And if it isn't, it's because there'll be a static somewhere. So the first thing we want to do is de-schmutz the field. And the way we do that is by using the harmonic fifth. Have you all seen the Vitruvian Man? Leonardo's Vitruvian Man. There's a divine ratio in nature which gives you the spiraling galaxies, it gives you the shells. It's called the Fibonacci series, or the golden mean. If you take C and G, there's a fifth. This is the white notes on the piano. That is a fifth. And that gets us into the mathematical Fibonacci number, phi, the golden mean. So if we use that frequency, we can basically restore the field by working a protocol to clear the static in the energy field. So typically we'd start in the back. And sometimes you'll hear little areas where the sound just wavers. It's a bit like doing the dusting at home, you know, you're kind of going around with a duster, getting the superficial dust out of the way. But there might still be a smudge on your piano top, you know. If you've got your nice grand piano, you have to take the dust off it, but then there can still be fingerprints from the kids. That needs a little more. So we go around you could say the 8 points of the compass, north, east, south to west, and then you've got the ones in between. And then when we've done that, we just want to make sure that the field's integrated above the crown and below the feet, because we have two elements to the auric field. We've got the solar gravity field. We're pulled towards space and the sun. There's this, you could say, centrifugal force, and we call that the solar gravity field. And then there's the earth gravity field, where we're pulled into the earth, which is centripetal force. So we've got this balance between the two, and it's a much more involved explanation on the sort of subtle anatomy side of it. But essentially those two fields should be balanced. So we've got the idea of yes to life, where the field is spinning right into the body, which is inspiration. First breath, spirit comes in, yes to life. The death breath, expiration. If it's the last breath, it's death. That's spirit going out. Now during life, we've got a constant balance between the two. So we're saying yes and no the whole time, and it's like the heart beats. Every time the heart beats, that's another yes to life moment. It's another reinvestiture of the willingness to be incarnated in the body. When we get into left spin, you could say the tendency, if the field is in left spin, is to be more out of body than in the body. And that's why it's really important to detect left spin and fix it, because a lot of chronic disease is a left spinning phenomenon. So if we can de-schmutz the field, we've already cleared static out of the field, which means immediately the more superficial problems are now removed. Now the next thing we would do is we would work through each of the main energy centers. So you can put the still point.
The energy centers are the chakras, yeah?
Yeah. And every chakra links to a nerve gland center. So the crown chakra links to the pineal gland. The third eye links to the pituitary. The throat center, and you can hear it when you get to the level, links to the thyroid. The heart center links to the thymus, hub of the immune system. The solar plexus links to the pancreatic gland. So they're all nerve gland centers, essentially. Second chakra links more to we would say, the reproductive side of testes, ovaries. And then the base chakra links to adrenals. And then you think about the different chakras, and you think the red base chakra activates 0 to 7, we build our physical body, and then 7 to 14, we build the second orange chakra, and we build our emotions. That's when all the kids are fighting with each other, and if you've got girls, they'll come and, oh, so-and-so doesn't want to be my friend anymore, and they're working out all their emotions. And then, we go through this evolving process through all the different chakras, and by the time we've done 7 cycles of 7, we've matured through all of the chakras, and that's when, for women, you're going to get a very obvious menopause. So you come into your high priestess mode, and then you go right back down to the base chakra for the second time. And for the men, as we evolve through, when we get to 49, we have menopause, which no one wants to talk about.
Andropause, isn't it? Of course.
Andropause. I call it menopause. And the women all know the men are having their menopause, but the men don't want to admit it. So essentially, what we want to do at this point is just in a very basic way, clear the schmutz out of the field, and then bring balance and harmony into the primary chakras. Now, we also have secondary chakras. So in every joint of the body, so the TMJ, the shoulder, the elbow, the wrist, the hip, the knee, and the ankle, these link to what we call the secondary chakras. Now, we can get diagnostic now, where we can use a high C and a G, very different tone, creates quite a shrilled sound, and we can scan for dissonance. Do you hear that go wobbly there?
Paula, do you have like a shoulder issue or something?
Sorry? It's shoulder now.
So it's in the front of the shoulder rather than the back, which means it's more future orientated than past. The shoulder it's not like I've got a shoulder problem.
Right.
Because if you think about the reference point with the shoulder, it links to the second, the brow chakra. So that could be about future vision. It could be about, can I see my future clearly? Left side is feminine. So there could be an entry point into the hologram of this patient that isn't actually about a shoulder problem at all. We're not interested in what the symptom is, we just want to clear the field. Let me just check the others. Now you can do exactly the same thing with all the organs. You could say, if you're a dentist, you could scan every tooth. And you could link in and check to see whether you could have a root canal that's going wrong, and you'd hear ding, 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 ding over the area where the tooth is a problem. So depending on the question and your knowledge, sound can be really, really helpful. Because if you do have, let's say, a root canal that isn't going very well and the field isn't corrected, then it's going to be difficult for the body to heal itself at that level. So if you find dissonance, we can then correct it. So right now, these are steel tuning forks that we have specially made in the UK. They link to the Pythagorean scale, so it's not your normal A440, so it's the old music, and this is the note E, which is the note for the solar plexus. The solar plexus links very much into the yellow colour. It's about our emotions and our intellectual connection to the emotions and this is why a lot of people with solar plexus, yellow, the term yellow-bellied? And then you've got green-eyed monster, feeling a bit blue. Now, the language we use reflects, I think a lot of it is the arcane kind of knowledge coming through. So anyway, we would use the frequency for the solar plexus, which governs gut function. You could have an IBS gut problem, and the way we would fix your gut problem would be to take the dissonance out in the left shoulder. The left shoulder symbolically links to carrying responsibilities and burdens. And on the left side, that's the feminine burden. That's the burden of the mother. It's the burden for the family. It's So these archetypes are working, and once you can decode what's going on, you can start to clear the field. Once the field clears holographically, which is why it's called holosonic sound therapy, once we clear the hologram of the dissonance, then everything can start to work. Forwards into time and back into, because the past, the present and the future are all happening simultaneously. So anyway.
Okay, thank you, Paula.
I'm not quite there yet.
Oh, we've got about 5 or 10 minutes.
I'm just going to, your name is Paula?
Yes.
Yeah. I'm just going to let Paula hear the tone so she can integrate it through the auditory centres. And then we have to work on the, I'm sorry, I'm going to turn my back to you. I have to work on that area in the future of the field here. So I'm in the light body now, and I'm going to move this frequency through. This is very, very specific, laser-like treatment to get rid of that dissonance. And it's like a hot knife going through butter. And then you can feel when you get to the blocks, and then they just need that work. And then when we check again in a minute, the field should be clear. It's quite stubborn there. So it's an interesting one, because when you do this sort of work, you reach a point where you're not that interested in the symptom that the patient has. And it's quite fun. A lot of people come in, they want to challenge what you're doing, and they say, look, I'm not going to tell you anything about me. Check my field, do my meridian test, see what remedies come up, and then you tell me what you think is wrong with me. And I love doing it that way, because it's a really interesting, then you see if it dovetails with what they actually have wrong with them. Now I'm just going to put that directly on the body now, so you feel it into the physical body. Can you feel the vibration? Yeah.
What's wrong?
Yeah. So we need the steel tuning forks for the therapeutic side. We didn't do this in Lisbon, didn't have time, but this is the real work. Okay, that's good. So now it's not wobbly anymore. Can you hear the difference between ding, 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 and ding? So if there's an incoherence in the field, it'll make it like a shelf, where it goes wah, 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 and it's not a change in tone, it's a change in the coherence of the field. And if the field is now coherent, then the light that represents, you could say, the level 2 soul, okay, at this higher level, relative to the burden of the feminine, with an emphasis on self-image and all of this. So I don't know, I mean, there'd be a whole story that I would... Anyway. Thank you. Sorry?
We don't discuss
Not publicly, no.
Thank you, Paula. What's the one thing you'd wish for people to understand about being healthy and being in tune with their own energy fields?
I think in the pursuit of health, the first thing you have to do is be spiritually happy, and you have to feel that you're connected to your life purpose. And for me, that speaks to all of this, because I think you can put up with a pretty shitty diet, and you can put up with quite a few challenges in life if you're properly connected to the field. If your light body is speaking to every cell of your body, I think we can tolerate quite a lot. And I think a lot of the niggly health problems that people suffer with, if they could only be reacquainted with the light of the soul, a lot of those problems would go away. So I think doctors' waiting rooms and hospital, the health centres are full of people that are not connected to their light body. So for me, the big thing that we'd like to do, and we'll certainly start doing that here, is starting to teach the very simple methods using the sound initially, because that's just not complicated. You can teach a mum how to, first of all, they've got to come into the classroom and really understand the philosophy of why we're doing what we're doing, because that's super interesting. But really,
And you're teaching this soon?
Yeah, we're going to do a big class in February.
Whereabouts?
Here in Dubai. Yeah.
Do you know? You'll give me the details.
Good.
At the
Yeah.
Kiani, okay.
So, I'm seeing patients at the Kiani clinic when I'm in town. So anyone that might be interested can book in there. So I've got slots tomorrow and Friday, then I'm going home again to England. I'll be back in January, but in February at the end of... Jade, when are you going on your course? Because end of Feb. Right, well we need to talk about, So we want to make sure that everyone can learn the philosophy of holosonic sound therapy and the method, because you can put those tuning forks into the hand of a mum and she can do amazing work.
For her own kids.
Illness.
Amazing.
And that you can teach to the lay public, so.
Any questions, guys? He's gonna give you the mic up.
Hello. So first I would like to say that for those who have this remedies, maybe it's more interesting that
Well, I can't hear. Why don't you give them my mic?
Yeah, it's not loud enough. It's always the problem.
remedies, so things you cannot do it gently in body and being fragmented, which are antidotes of homeopathics. So many people using homeopathics without.
That's true for classical homeopathy, that's not true for our combination remedies.
Yes, but even with combination remedies, we can have this chat afterwards. It's better to avoid this long.
Better to, but it's not, because our hand-succussed remedies, they have such a strong force behind them that you cannot antidote them with coffee or peppermint toothpaste.
But if you're looking about biofields and you want to be healthy, of course, I mean, it's better to do it the right way, right?
Correct.
So we have to say what is the right way, and after the person can decide if he's gonna gamble on the bio that he has. Second, I would also want, and if you have ever done some racing studies using different devices, because there are many devices, online cards for the signature, scanning of the body and the results, and what to as a summary, they are information.
I think the key thing is that the vol type approach, it doesn't matter what ohm meter you've got, you're collecting a frequency measurement in the meridian.
But have you done a
I've got 4 different machines, and done correctly, you're going to get the same data. Now that's not true for the bioscan machines. Like you might have a Skio, and then you might have a bioscan or some of the Russian instruments where it's head straps and holding on to electrodes. That's not EAV. That's bioscanning. That's bioresonance scanning.
different devices, different.
Yeah, that's not measuring the meridian. It's not measuring a microcurrent through the meridian. What those machines do is they pick up a lot of noise, frankly, noise that's in the field and in the cellular matrix, in the ECM and the extracellular matrix and the intracellular matrix. It all carries frequencies. Now, the question mark with those machines is they might say, oh, you've got parasites, or you've got this metal, or you've got this glyphosate signature that we need, or lime, or whatever. The problem is with those is that if you do a scan and you get the information, and then you go for a walk around the block, and you come back 10 minutes later and you do the same scan on the same patient, having done nothing to them, you'll get very different data.
So it depends which
I just think that from the bioscanning point of view, when you're inverting frequencies to clear those static frequencies out of the matrix, if we could call it that, that's helpful. but it's not as specific. Like the cancer guy, we had to get very, very specific. It wouldn't have been enough just to put a bioscan unit on him and scan him. So they have their place. For me, I mean, I've got those machines in my clinic. I very, very rarely use them because for me, the sound will take out most of what you need to get rid of at that level. It's cleared by the sound frequencies. No. It's holosonic sound therapy.
Because aquaponics is a therapy method which is using tuning forks.
It's a very different method with a different philosophy that sits behind it.
I think do you want to continue? I have a couple of other questions.
Different approach to using tuning forks. There are lots of different approaches. Yeah.
People to know that there are different methods for using
Yes.
tuning forks. Not
Yes.
the only one, right?
Yeah. No, correct. Hello. Yeah, we do a lot with the kids on the spectrum, and if there's been issues with neurotoxicity from whatever source, we know that there are huge problems for a lot of the kids with early, vaccines and stuff like that, treatment that they're given, which is suppressive. When a child's growing and they're getting fevers, quite often we just push the fever back, and that drives, we've got to be more intelligent about how we support pediatric health. There's a huge component there. And there are lots of question marks about that right now. I mean, I can say my kids have had no vaccines at all. Charlotte's 28, she's also an osteopath. Gabby's 27, and B, my youngster, is 17. They've been perfectly healthy, and they haven't endangered anybody else. Now, that's one aspect, but don't forget we've got environmental toxins all around us as well. These kids are really, we have got transgenerational toxicity, not just physical toxins that come through from the mother to the child, but we're spiritually toxic. Okay, so these kids, every generation that comes through, they're more and more in trouble, and that's why we have to have these methods of clearing the field, because our children need to conceive the sperm and the egg that creates the next generation need to be clean. They need to be clear of all this. I nearly said a rude word. We've got to get that schmutz out. And we've got to make sure that when our kids see their kids, that they're in clear space. And we call that preconceptual bioenergetic planning. It's like a lot of the kids now are doing that. And I've got women who are bringing their future husband. They're going, "Can you check him out for me? I just want to make sure he's going to be okay." I started dating this guy. And they're going to send him in for a treatment just so I can give them the go-ahead as to whether he's going to be all right or not. So I think there's more awareness coming now, and certainly for the kids, we do an awful lot with the autistic spectrum. I mean, they say it's genetic. I mean, if you can reverse a kid back out of autism, then that's not a genetic problem. That's an environmental problem. So the answer is yes. If there's a coherent brain field, we have an advanced technique called the rainbow brain, which I developed for clearing the brain particularly. That's something that we do with the kids very, very successfully. Yeah. Yeah, it is. I mean, it's just one range of the colour spectrum, of course. I mean, we have a colour therapy device called monochrome, which is all the different colours. It's like a big hood that goes over, and you can select which. The colour frequencies are just the next level up from the sound. So, you've got light, colour, sound. These are all linked in terms of the therapeutic spectrum. And once you understand what to do with them, you can get into some profound healing shifts. Sometimes with an area of dissonance, for example, with the shoulder problem there, we might be able to fix that just with a tuning fork. If it doesn't resolve, then a needle has to go in, and then you can use coloured lasers directly as well. So you've got, you've got the sound going in, you've got the light there, and you've got the needle there. So it's going into the fascia, because the fascia communicates. So those are more advanced. You can't teach that to housewives to take that home for their families, but that we teach to the medically qualified practitioners who come through our program, and it gets very specific, laser-like specific frequency medicine into the hologram of the light body is what we would say. Pleasure.
And there's very raising the question already. My question is, since you're talking about the skin and the life or the inspiration, is there a way that you could use the music therapy, such as tuning forks, to control sounds that on the back aspect and then see organs come to life? I know it's not possible for everything.
So did you say bringing someone to
No,
life?
can you control life expectancy?
Well, my personal belief is that if we've got the connection to the light pod, I'm 58 years old, and I feel like I'm 28 years old, and I think it's true for people that when they're properly plugged into that's a powerful field. That's really important, that if every cell of the body is connected to the light of the soul and the light of the spirit of us, we will be vital and healthy, we will live long, healthy lives. We've just got to manage our environment. Because what you put into your body, whether it's the TV that you're watching, the books that you're reading, or the food that you're eating, or the water that you're drinking. We had a long corridor. This is a night. Talk to this lady about water here.
She is the water wonder woman. That's my word for her.
And we're going to do more on.
It's incredible.
We've got to bring more awareness to how important. Because I said earlier, the body precipitates out of the blood. The fluid body carries the information. The fluids in the body are structured. And it's, we are liquid crystals, so it's quite important that we put, really good water into our body. And we've got a really nice connection into the people that understand that stuff. And the idea will be to bring them here to sort of open up that conversation. So a lot of the crowd from Lisbon are interested to come. So watch this space, because we'll probably be running seminars around that as well as everything else in the new year. Can we live longer if the field is vital, flowing? If we're saying that we're connected to our mission in the world, if we're inspired, not just from what we breathe in, but inspired literally in life, then I think we will live much longer. There's nothing going to kill you quicker than not having a purpose. I mean, look at the guys that retire. I see a lot of the city boys in London, and when they stop, you see them dying in front of you because they don't have a purpose anymore. They're rich and they're driving around in a nice car and they're playing golf 3 times a week, but they just, everyone needs a purpose.
Thank you.
One last question, and then of course you guys can talk to Dr. Geoffrey after this. Just it's recess.
Thank you for that. My next question is, when we were to redo that over and over again without doing any treatment, would it give the same results?
If you redo the test, well, one day to the next, you might see similar readings, but when you put the microcurrent through the meridian, by nature of the fact that a current went through the meridian, you change. This is why you need a skilled practitioner, because you've got to get the reading really with one measurement. You can't afford to be mucking about going like 5 times into the large intestine, because as soon as it's had the current go through it, it's already changed. Now, what it won't do, if you've got a really deep blockage where it's deep in the yellow, you can flush the point with the current and it won't change it. So, I mean, those are genuinely deep blocked meridians that, that will get you a consistent, if you go back over and over again. But typically, we want to do the EAV test, and that's why we have to have a skilled practitioner doing it, because you've got one go to get the measurement, and you need to go all the way around, find the entry point into the story, which is going to be the worst point, the one that's most out of shape, and that's the point you use to find the medicines. Like with Paul, the cancer guy, we went into the lung pathway. I mean, coincidentally, it was where he had the tumour. I mean, I've had cases where one lady had a big pancreatic tumour, She had dissonance in the energy field over the pancreas, but when we measured the meridians, her pancreas meridian was perfect. But the bile ducts on the liver side were they were like 16, they were completely broken. So we found a remedy for the bile ducts, which is why she created a tumour in the pancreas, and her tumour within 4 months it had shrunk to 1/3 of the size. Because we took away the root cause, which was in the bile ducts, in the biliary system. So if you came to me for a session and we did nothing, and then you went and saw my colleague Sarah in Richmond in London, who's also a skilled practitioner, she would find exactly the same. It is duplicatable, and that's important because the bioscanning devices, when you go the ping 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 with the head strap, you'll never get the same data twice. But it doesn't mean they're not useful instruments. But yeah, it is duplicatable for sure.
One last? We good?
I don't know if we've got slots tomorrow afternoon and Friday morning. Kiani, if you ring, you can look it up. Kiani Clinic is where I'm visiting as a practitioner when I'm in town. And then I guess I'm not really big on Instagram like some people. Bernadette, you're massively on Instagram, aren't you? And everyone should follow Bernadette Abrahams. If you don't already know her, she's done a remarkable job with providing a resource for people who've got health issues. So that's definitely somebody you should be following here. I will notify on my Facebook/Instagram if I'm going to be here running classes. If you're following me, then you'll probably see that information. And I also am learning about WhatsApp groups.
Yes.
So I need to start putting people into a
Instagram, WhatsApp groups, all of that.
I'm not very good at it.
Unfortunately, what can we do? It's the world we live in.
Yeah, I don't know how to do it.
Yeah.
Yeah.
Thank you so much. Thank you for bringing your energy and all your energies. This was such a great session. I think this is our last physical session for the year. We'll keep you posted on any future sessions. In the meantime, if you could all follow the SIG Learning Series on Instagram, that would be great. Okay. Thank you
so much for the invitation.